Yeah, so I usually tell parents that language is language, right? In the brain, your language is developing in the same part. So we can expect to see similar patterns. If they have a delay in a certain area in English and they're trying to learn Chinese, they might see that same delay, and it's something we can work on. And typically, when it's corrected in one language, it'll automatically correct in the other. But again, each child is unique, and further assessment can help us really understand, but that's typically how language develops.
Many parents quietly worry when raising a child exposed to more than one language, especially if that child shows signs of developmental delay. Will speaking two languages confuse them? Should we drop one language to help? Are we making communication harder for them? The advice out there is often outdated, and the myths are still everywhere. Hi, I'm Atusa Mozaffar Zangene, and this is Enara Talks. Today, we are diving into bilingualism in early intervention, not just what it means, but how it truly impacts families navigating these choices at home. Our guest today is Dr. Tina Younes, a bilingual speech and language pathologist with over 12 years of international experience. She witnesses the fears, the breakthroughs, and the beauty of bilingualism firsthand, and she's here to share what really matters. Hi, Dr. Tina. I'm so happy to have you here today.
Hi, I'm excited to be here. Thank you.
Okay, let's start with basics. What do you mean by bilingualism in early intervention and childhood, and how it's typically present in the child we see?
Yeah, so when we're saying bilingualism, that specifically means children who are learning two languages or more. But oftentimes, bilingualism is also used as a blanket term for kids just learning even more than two languages, whether they're trilingual, multilingual, but it can be any languages.
Yeah, I see. And there are still lots of myths about and around bilingualism, especially in early intervention. What are some common misconceptions that you may come across?
Yes, there are so many myths still, which is unfortunate, especially here in Dubai, where everyone is bilingual, if not multilingual. I would say the most common one that I hear that is just really upsetting to me is that you only need to stick to one language while a child is growing up, because there's been so much recent research that shows that's not true. You can expose your child to multiple languages, talk to them in mixed languages, and they're still going to be developing that language.
Yeah, true. And how does language development look different in bilingual children compared to monolingual ones? If is there any difference at all?
So, for the most part, not really. Language development is going to be developing normally. What you might start to see is that they're mixing different grammatical patterns between the languages, mixing the word order. But in terms of developing language across languages, it's pretty consistent.
Yeah, let's go back to that myth that you mentioned earlier. We know that there are some developmental red flags for all of the children. Are there any specific ones for bilingual or multilingual children, and how we can actually distinguish them from typical kids?
Yeah, that's a great question. So, there's not specifically red flags for multilingual children. What we would be looking for is essentially the same red flags you would look for in a child just speaking one language or learning one language. There can be unique cases where a child has a disorder in a specific language, but that's pretty rare. So things to look for are the vocabulary isn't developing in both languages. They're not following instructions in either language. They're having a difficult time communicating their wants and needs regardless of the language being used.
And can you tell us about some challenges that when there are two languages developed in the same time, what will happen for the family and child?
Yeah, so developmentally, there aren't really any challenges.
Mhm.
But I think, especially in those younger years, kids might get confused and be like, I don't know which language to talk right now. Or you might notice they're mixing the languages, but that's normal for multi-language development. It's called code switching, code mixing. And pretty quickly, kids will learn, like, oh, this teacher speaks English, mom and dad speak Arabic, my friend speaks French. And kids are pretty quick to learn those differences.
Okay, and then they can pick up the proper one when they are communicating.
Yes,
Perfect.
exactly.
And let's jump to the therapist part. So, what are some challenges that clinicians facing when they are working with multilingual or bilingual families, and especially when we want to actually do the standards test, which maybe is not actually covering both languages?
Yeah, that's a great question, especially here in Dubai. There are so many speech therapists who are also speaking multiple languages, but that doesn't necessarily mean you're going to speak every language in the world or every language your patients speak. Um, so I think the biggest challenge is educating ourselves on the differences between the main language and the language they're learning. So let's say the main language is English. If you don't have an understanding in Spanish or Italian or Arabic, it's going to be harder for you to differentiate what is a language difference versus a disorder. Or what's a delay versus this is not normal. They haven't been exposed to it because that thing doesn't exist in Italy where it might exist in Canada or America. And I'd say a majority of standardized assessments are for monolingual English-speaking children from North America. So educating ourselves as therapists on that, being able to understand, oh, they called the cookie a biscuit. That's not wrong. It's right. And being able to accommodate that when you are analyzing the assessment results.
So you suggest that let's consider the culture and language differences in
Absolutely,
these cases.
yeah. And that's a great point. It's not just language, it's also their culture, what they're exposed to, what their family believes in, places they've traveled, things they've seen. That all plays a role.
Yeah, indeed. And as we sometimes hear, some professionals advise to the families that stick to one language and let's put the other one aside. What do you think about this?
It just breaks my heart because it's
Yeah.
so important for the culture of the family, for the community, for the child to be exposed to their home language or to that second language. And I think in the past that was pretty common, but now we have so much research and literature that supports that that's not true. Teaching your child multiple languages, whether or not they're typically developing, isn't going to impact their development any further.
Yeah, so you said that consider communication, not only language, because it's the
Exactly.
important point for us, that let the children communicate effectively.
Exactly.
Yeah, sure. So, how we can actually incorporate two languages when we are doing the treatment plan or when we are doing therapy, especially when the therapist, as you mentioned, doesn't speak one of the languages?
Yeah, I think educating ourselves, having that conversation with the family, asking them what are some common words that you use at home. If we're teaching a child, let's say fruits and vegetables, learn from the family. What fruits and vegetables do they eat? Like growing up, I ate mlokhii, kusawara. People don't know what that is in America. They're like, you eat leaves for lunch and dinner. So really understanding that the words we typically might teach or the foods that come in play kits might not be the same foods that the child is eating at home that they have exposure to. So educate yourself from the literature, but also every family is different. So just because a family is from Italy, their culture and words might be different than someone from Southern Italy. So really understanding the nuances to each family and their community specifically.
Yeah, very good point. And if family asks us that we want to focus on one language, what is your suggestion for them?
I usually try to understand why, and then I educate them. But ultimately, it's the family's decision. If they only want to work on English, great. If they only want to work on Arabic, great. But I try to educate them that there isn't necessarily a benefit to focusing on one language, and I teach them both sides. I don't tell them this is better, that's better. I educate them on both sides and let them make the decision. One thing I think that's pretty common here in Dubai is we'll get families who only speak Arabic at home. Their child goes to Arabic school, but they want therapy in English. So cases like that, we don't recommend it because if our therapy is in English, this child has never spoken English, then it's hard to understand what is a delay or disorder versus what is English is a brand new language to me. And that's why I'm struggling.
Yeah, true. So everything ultimately will go to the families. So can you give us an example about how we can train families and do this family-centered therapy with bilingual kids?
Yeah, absolutely. I'll use my current workplace as an example. So at Hakini, we really focus on make it a family-centered treatment plan. So before we even start working with the child, we sit with the parents for an hour just to understand, why are you here? What do you need from us? What support can we give you specifically? And as we develop the treatment plan, we ask the family, does this sound like something that's going to transfer to your house, that's going to make your life easier? A lot of times I think as therapists, we get caught in this, oh, this is what the test score said, so this is what we need to do next, and not understanding that maybe that's not important to the family. And to support that bilingualism, I always tell parents, if traveling to your home country or if family isn't around and those aren't options, look at movies, music in the car in your home language, different books. Like that exposure really helps children also understand the differences of their culture and the languages.
Yeah, so you mentioned the culture importance several times. So also we will ask them to add this culture points to this practice. Do we do this?
Yes, as much as you can. And like I said, in Dubai, there's so many therapists. So if you get a family who is from a country you don't have a lot of experience with, or a language you don't have a lot of experience with, let the family know, like, oh, I don't have a lot of experience, but let me refer you to someone who does. Because, yeah, like we just said, that cultural community part is also just as important, because you want to build that relationship with the family, you want to build that relationship with the child, and you want to make sure you're educating them in a way that's meaningful and functional for them.
Yeah, absolutely. And what strategies do you recommend to parents who want to support both languages, especially at home when they are worried or confused, or even they want to help their child who has delay?
Yeah, I think I touched on that a bit, but I can go into it
Yeah.
more. Using both languages at home. So,
Mhm.
growing up, I learned Arabic and English at the same time in Midwest America. So, there were no other Arabic speakers
Okay.
besides my family. So, my parents had a rule: if they talked to me in Arabic, I needed to respond in Arabic.
Mhm.
So, that didn't put the pressure on them to talk Arabic 100% of the time, but it set that expectation where if you talk Arabic, I respond in Arabic. If you talk English, I can respond in English. So setting expectations that are realistic. Um, it's a lot of times parents put stress on themselves, being like, I need to talk French. Their dad needs to talk Spanish with them. They'll learn English at school.
Mhm.
And then they feel guilty when at the end of the day, they're like, oh, I spoke English all day. So setting realistic expectations, like I said before, movies, books, songs, that's all great for children to learn vocabulary, to be exposed to the language. And as much as possible, if it is an option, talking with family, finding other families who speak the same language or have the same culture to get that more exposure experience as well.
Perfect. And what kind of resources, tools, or if it's possible, community support can be helpful for bilingual families and also therapists?
Yeah, I think for therapists, connecting with therapists and getting to know our community here in Dubai. I know at Hakini, we have 4 speech therapists and we're all from a different country. So we all have a little bit of a different background and understanding of the culture we're from, the language we speak in our home country. And I really encourage therapists in Dubai to reach out and refer when necessary, because we're in it for the child, right? We're not in it for ourselves. We're in it to make sure they're getting the support they need. And the same for the families. If you meet a speech therapist and you're like, oh, they don't really have that understanding, you don't have to stay with them. You can shop around. You can ask them if they know someone, and really just being open and honest in our approach so that we're helping families, families are helping us, and we're all educating each other in the right way.
Yeah, I guess that Dubai is a very unique example that we can actually understand about other cultures and languages and
Mm-hmm.
learn about it. And also, families have so many opportunities for this. What about tools or resources? Are there any tools or resources that you suggest for therapists and also families which working with bilingual kids?
Yeah, for therapists, I'd say continued education. So whether that's podcasts or getting online, I know Asha has a lot of courses, the Informed SLP. There are a lot of resources out there, but I think our biggest tool is each other. Because like you said, Dubai is a unique community. When I was in America, most people around me weren't bilingual. So I didn't have that opportunity to learn from my colleagues. Whereas here, like I said, at Hakimi, we're all from different countries. So I do have that opportunity. And for parents, I think the best tools are trusting yourself as a parent. Like at the end of the day, trust your mom heart if you feel like something's wrong or that it really is just confusion. Advocate for your child, trust that, and really expose them to those languages you want them to learn.
Okay. Is there any other myth or challenge that you want to actually point to it about multilingual and bilingual kids?
There's so many. I think,
Important ones.
yeah, I think another common one is if they don't learn the language when they're little, they're never going to learn the language. And I think that terrifies parents, especially here in Dubai, where English is such a prominent language. And because of the state of the world, travel is a bit difficult right now for a lot of countries where people would want to go to help let them be with their family. So I think don't panic, don't put that stress. That language development is going to happen. So like I said, I learned Arabic and English at the same time growing up, but I was mostly exposed to English at school with my friends. And as I got older, my Arabic got stronger because I started to understand our family's culture. I started to listen to Arabic music just naturally. My parents got Arabic channels, so we were able to watch TV. And then we had that privilege of traveling back to Palestine where I could engage with my cousins and really use it and see the functional purpose of it. So I think finding a community, let's say you're Lebanese, finding other Lebanese families for your child to engage with. So it's not just this abstract language we speak at home, but you're giving it more functional and more meaning behind it as well.
Dr. Tina, I have another question about dialects and accents. So many times this happened that even if we are talking in the same language, we have different accents. What should we do about this?
Yeah, that's a great point, actually, especially when we're looking at the Arabic language where there's so many different dialects and nuances in the language itself. I think from a therapist perspective, it's important to understand what dialect your family's using, your patient is using, so that you can educate yourself on and ensure that you are teaching them the correct dialect for them. And for families, also letting your child know if they are with other Arabic, French, Italian speakers that it might sound a little different, but doesn't mean it's wrong. It's just a little bit different. So understanding those nuances is important in treatment.
Of course. And as you mentioned, there are differences in accents. As a therapist, shall we address these differences as a pathologic point and start treatment about them, or no, we should leave them?
Yeah, that's another great thing. I think a lot of families come in and they're like, my child can't say these sounds. But when you look at their native language or their first language, those sounds don't necessarily exist in it. So, what we usually would do is take an inventory of the sounds in both languages and see if those are produced correctly. If those are correctly, it would just be considered a dialectal difference that wouldn't really qualify the child for treatment. If the family was interested in them fixing their accent or not having that, that would be more of an English as a second language course versus something to come to speech therapy for.
Yeah, very good point. And I want to have another question. Sometimes we're faced with this question from parents that, okay, the child is monolingual and the child had delay on that language, but now they want to start the second language. Um, what we should do and what is the actual concerns around this?
Yeah, so I usually tell parents that language is language, right? And the brain, your language is developing in the same part. So we can expect to see similar patterns. If they have a delay in a certain area in English and they're trying to learn Chinese, they might see that same delay. And it's something we can work on. And typically, when it's corrected in one language, it'll automatically correct in the other. But again, each child is unique and further assessment can help us really understand. But that's typically how language develops.
True. Of course, that there is some age that is very golden time, and children can pick up language better in that time, but it's never late for learning
Exactly.
the second language, as you mentioned. So, if there's one takeaway, what do you want professionals or parents to leave with today? What would it be?
I think my biggest takeaway would be teach your children your culture and your language. It's a gift to come from multiple. And in the state of the world right now, we need to be proud of where we come from. So teach them what you want to teach them and trust the process.
Perfect. Thank you so much, Dr. Tina.
Of course, thank you.
Dr. Tina, thanks a lot. Not just for the knowledge you dropped, but for the real care you show every family you work with. If you are listening and this conversation hits you in any way, made you think or change how you see bilingualism and early intervention, please share it. These stories need to get out there. All right, that's it for now. This is Enara Talks. Stay curious, stay open, and keep believing in the incredible potential every child has.